The work of Vancouver Coastal Health on healthy public policies really begins with the talented team that we've been able to assemble. So I think we've put a great deal of thought and care into hiring people with a traditional public health skill set and also hiring people from outside of public health. So people with skills that are rooted in social innovation, people who come from academic institutions, people who worked in local government settings and the nonprofit sector. So this workforce mix, I think, is what helps us to bring diverse and innovative perspectives and skill sets and to support building healthy public policy skill sets. We also have two important roles. One is a practice lead for capacity research and evaluation, and the other is a KT and comms lead. And these two roles support the whole team to build the HPP skills, if you will. Especially for KT, we don't want that skill set to live just within one person, but rather to support the whole team to understand the importance of effective knowledge mobilization for action. I would say that we strive to make sure that we are equity-oriented and that everything we do is centered around relationships. So it's often said that relationships are built at the speed of trust and that social change happens at the speed of relationship. So we really do take this to heart and understand that healthy public policy work happens in complexity and it happens in community, and therefore it's quite a long game. Underpinning everything we do is a recognition that health is very much socially and structurally determined. And so with that in mind, when we think about healthy public policy and health in all policies, by its very nature, it needs to be multi-sectoral. So partnerships and collaboration are the way that we approach everything. And our main focus is to focus on the local level communities. We do try to engage in a bit of healthy public policy work at provincial and federal levels, but that's less common than really engaging with school districts, with local governments, community-based organizations, and so on. I'll give an example of healthy public policy work we're currently doing with respect to child and youth mental well-being. So post-pandemic, even before the pandemic, this was a significant issue for public health. We brought together a group of people from near and far to host a Best Brains exchange to talk about what child and youth mental well-being looks like post-pandemic, and also sort of chat through solutions for what we could do about it as a public health community and in collaboration with our partners. So not necessarily public health out in the lead, but just working together. So we had a person on our team pull together an evidence review. This was significant, pretty large. And so we decided to partner with a provincial organization called BC Healthy Communities. In that partnership, we created a set of resource guides. And the resource guides are targeted at actions local governments can take to make a positive difference in child and youth mental well-being. We landed on 4 protective factors because these are factors that are quite likely to be influenced by local governments, and they were impacted during the pandemic. So those are play, participation, safety, social belonging, and connection. In those guides, we have presented the evidence. We have also given examples from other jurisdictions and then highlighted what social policy could look like within a local government context. We are now in the midst of hosting webinars with our partner, BC Healthy Communities. And the nice thing about it is that we'll be mobilizing and having these conversations and hope to see work locally in our health region. But BC Healthy Communities is a provincial serving organization, so this information can go well beyond the boundaries of our geographic scope. We do have senior policy leads on our team as well who will use the guides as a conversation starter, go into community and chat based on the relationships they already have with staff working in local government around where are they at in terms of work they might currently have underway around child and youth mental well-being. So there have already been a few spin-off projects. I will just briefly describe a couple of them, 2 that are coastal, rural in nature. One is, they're obviously all youth-focused. The first one is about engaging youth to participate directly in policy-making processes with the local, regional, district government. So there will be an individual who goes into high schools and trains youth. And then the great thing about this is that youth participation will also be able to influence the upcoming refresh or renewal of the official community plan for that community. There's another one in our region that's a little further up the coast, still coastal rural, wherein it's a research project. So we have a university partner, local government partner, and ourselves as the health authority as a partner. And that one is looking at inclusion for youth and factors that contribute to sense of belonging and community. And similarly, what emerges from that research project will also inform the refresh and the renewal of the official community plan. And then the last example I'll share is we have a mid-sized town up the coast on the mainland who are seeking to bring the Youth Climate Corps model to their town. So we are supporting them through having a staff person come alongside in the project, add support, add capacity. We will also help them to develop an impact tracking framework. And then a key role of our staff in the Healthy Public Policy Unit will also be to figure out, once that program is established, what are the learnings and how can we share the knowledge with other communities across the region if they would also like to establish a youth climate corps. So you can see with the examples that I've shared in terms of how we approach our work, it really is about coming together to, I think, amplify and lend energy, and then also share our collective resources, really around bringing a health lens to priorities and goals that communities have already identified.